Welcome back. Let's talk about healthy living now. We continue to follow the massive fire, and that is simply one thing that can aggravate your lungs, especially for kids that deal with asthma flare-ups. And science is now showing doctors that asthma flare-ups are more complicated than they originally thought. So that also means that they are caused by multiple factors. And joining us now to tell us all of the important new information is Dr. Reena Mehta from Uptown Allergy and Asthma. We've been having a great conversation about all the science. Thanks for being here.
Thank you for having me.
Absolutely. So first of all, tell us about the different types of asthma that you now call phenotyping.
Yes, we call it phenotyping. So, whenever I see a patient with asthma, the first thing that I like to do is try to better characterize their asthma.
Right.
So what drives their asthma? And it's interesting because most patients with asthma might have 80 different things that might trigger their asthma.
Sure.
And so what we try to do is do some blood work to better understand what those inflammatory markers are. So 50 to 60% of patients have something called eosinophilic asthma.
Okay.
Eosinophils are a white blood cell in the body that gets, when it increases in amount, it causes this inflammation, and a lot of times it's skewed to an allergic type response.
Wow.
So we have a lot of treatment modalities where we can treat eosinophilic asthma with something called biologics, which is an injectable medication that can actually bring those eosinophils down. But what we're learning is children with asthma who have an immune system that's evolving, it's growing, it's expanding, it's maturing, there might be more triggers than just eosinophils.
So how do you determine what those triggers are, and is there a better treatment once you know that?
So that's a great question. So this was a study that was just published in August in JAMA Pediatrics, where they took 290 children with asthma, and they were on an eosinophilic medication called mepolizumab. So it was an injection. And what they found was that more than 50% were still having asthma flares. So while their eosinophilic and allergic immune response calmed down and it was better, they were still having flares. So what they were trying to figure out using nasal samples was what drives that. And they found that it could be things like viral infections. It could be things that irritate the lining of the lungs. So that may be things where we see in inner city like fires, like pollution, like secondhand smoke. And so if we can better understand what irritates a child's lungs, then maybe we can have more precision therapy, not just treatment for eosinophilic asthma.
Doctor, why is it so important to get the triggers right?
It's important to get the triggers right because that affects treatment. And so if you are putting these children on these heavy-duty medications, you want to make sure to get it right because you want to treat their asthma. Because if you're not, then the inflammation continues. They end up in the hospital. They end up more sick. And so, again, while there can be multiple drivers of airway inflammation and asthma, if you can better phenotype a child's asthma, you can treat it better.
So give us the real life example here. Let's say there's a child that is exposed to the smoke from the fire that we're seeing in inner city New Orleans like this. Then what would you say there is to learn about how the child is doing today?
Yeah, so, obviously when I see a patient like this and they're flared, the first treatment courses get them out of the flare. So, that may be more emergency type treatments like nebulizers, inhalers, steroids, things like that.
Sure.
But then it's, there becomes a pattern of, okay, this child is always driven by a virus. This child's asthma is always driven by, external factors like exercise or smoke. And so basically once you identify that, then you can try to find maybe the right type of inhaler or the right type of biologic that can calm that immune response down.
This is such an important thing to continue learning about. So many kids impacted by this.
And I think the bottom line is, keep up with your asthma with your doctor. Make sure that you are going to the doctor when your asthma is flared so that the doctor can better treat it.
That's it. All right, and we will let you get back to your patients. Dr. Mehta, thank you so much.
Thank you for having me.